Hello, everyone. Welcome to the Insurance and Nonprofits Statewide Town Hall. My name is Henry Duong, and I am the Education Manager and Los Angeles representative at the California Association of Nonprofits, or Cal Nonprofits for short. It is my honor to introduce Jan Masaoka, CEO of the California Association of Nonprofits, who will serve as our moderator today. Take it away, Jan.
Thanks, Henry. Hey, it's so fun. It's fun to see all the people that I know and all the new people. So thanks everybody for joining us. Welcome to this nonprofit town hall with Insurance Commissioner Ricardo Lara. We have 651 people registered for today, so it's great to see that much interest in a topic like insurance, which may not be kind of just at the top of your list of things that you most wanted to learn about today. And it's really an honor for us to have a statewide elected officer here. And not all elected officials make themselves as available to the public as Commissioner Lara has. And so we really appreciate and value his time here today. So before introducing him a little bit more, I just want to give a little bit of context for this session. So as you know, we at Cal Nonprofits are a membership alliance of more than 10,000 nonprofits, and we predominantly work in policy, working on behalf of California's nonprofit community. And our goal is to help create a legislative, administrative, and regulatory climate that helps nonprofits thrive. And certainly one of those areas is the area of insurance. For most nonprofits, insurance is their third biggest cost, after personnel and then rent and then insurance. And of those three, I think probably insurance is the one that people kind of know the least about, or the least able to kind of unpack and see what all those components are in there. And we at Cal Nonprofits have a special interest in insurance, I have to say, because we also have a social enterprise, Cal Nonprofits Insurance Services, CNIS, through which we have I can't remember the exact number, but more than 2,000 nonprofits as insurance clients, and we provide health insurance to more than 25,000 nonprofit employees in California. So we are, on top of being a policy alliance, we are also very happy that through our subsidiary, Cal Nonprofits Insurance Services, that we're also helping to provide insurance, particularly to those nonprofits that may have trouble getting it through another broker. And so just, let me just look here. I also want to thank everybody for being here, because nobody thinks their insurance costs are too low. So I'm assuming that nobody's going to type in questions, like, why is my insurance so low? But particularly, I think, with wildfires, the earthquakes in the last couple of years, and now the pandemic, insurance is just a lot more in the forefront of the media and in all of our minds. And we have been hearing so much from California nonprofits about concerns about insurance, about rates increasing even more dramatically than before, and also the increased difficulty in getting insurance for some difficult areas. Now, while nonprofits are never specifically carved out, like nonprofits can't do this or can do this in the world of insurance, some of the things that are especially hard to insure are things that are predominantly or typically done by nonprofits. So, for example, helping people in homeless encampments, working with people who are especially vulnerable, doing environmental work near wildfire areas, placing rescued animals in volunteer foster homes. So these kinds of activities tend to be harder to insure, and they are, of course, all typically nonprofit activities. So that's why it's very important for us to be having a nonprofit focused town hall and to have the insurance commissioner with us. Just to let you know, after the commissioner speaks, we'll be having some Q&A for, we got more than 95 questions in the advanced question section. So, he's planning to get to 94 of them, don't worry. No, we're not going to get to all of them, obviously, but the insurance department staff has kind of boiled some of them together down. So we'll be doing those. And then we'll be hearing from two nonprofits, Julia Clothier from Audubon Canyon Ranch and Stephen Waters from First Step Communities, so that the commissioner can also hear directly from some nonprofit voices how people are experiencing nonprofit in this day and age. All right, so now to introduce the commissioner. You know, he took office in 2019, in January of 2019, and I have to say, not everybody even remembers that the insurance commissioner in California is a statewide elected statewide elected office. I'm sorry. He was raised in East Los Angeles by immigrant parents, and when he was elected in late 2018, he made history by becoming the first openly gay person elected to statewide office in California history. And previously, he served in the California legislature, both as an assemblyman and as a state senator, representing kind of areas of the greater Los Angeles, Southern California region. And I think one thing from his legislative career that I think is really worth mentioning is that one of the things he did as a state senator is he authored the Health for All Kids Act, which has made it possible for an additional 250,000 California children to get Medi-Cal benefits regardless of their immigration status. So that's really an important victory for our communities, and we appreciate his leadership on that. And then during COVID, of course, which has been a difficult time to be in any kind of office, but one of the things he did was, because so many individuals and businesses and nonprofits, our risks plummeted, right? Because people weren't going into the field, for example, to visit foster homes or other areas. And people weren't coming into our facilities as much. So as insurance risks have plummeted, one of the things that the commissioner did was direct insurance companies to give refunds to customers who had reduced risk because of COVID. And that resulted in $1.7 billion in refunds. So I think these are really significant achievements that the commissioner has brought about for our communities. And so, Commissioner, we're very glad to hear from you, and thank you for coming and participating in this town hall. Let me hand it over to you.
Thank you, Jan. It's great to see you and great to take a moment to chat about insurance. You know, as you said, people don't often tend to want to have a conversation about insurance, but insurance is going to determine if we bounce back. Insurance determines if families are able to rebuild after a fire. And we often know that our most vulnerable communities are the ones that always are either underinsured or lack the insurance they need. And so I also want to acknowledge and thank Stephen Waters and Julia Clothier for participating in today's conversation. You know, for the last year, we've been facing a new common challenge in the global pandemic, and together we are taking action to bring us closer to some sort of recovery as we are now bouncing back, it seems, with this new variant. And 2020 was a historic year in more ways than one, unfortunately, and not one I actually want to see again, and I hope neither of you. Not only did we face COVID, but also extreme heat waves, and are still facing extreme heat waves, I should say, and also these massive wildfires across our state. The economic devastation caused by the pandemic has reached every sector of society, of course, including our nonprofits. And we are all here to share resources to help get you back on your feet and to help you do what you do best, is help others through your organizations that you lead. And we want to thank you for that. And insurance issues can be complicated for the average consumer. I'm continuing to learn about insurance as well as your insurance commissioner, and more so for organizations with singular needs like nonprofits. I'm here to help answer your questions along with my Deputy Commissioner, Tony Signorelli, and also, you know, take this time to listen and learn about the issues that you are facing. Your concerns will help inform any next steps we take to make sure that we help you not only overcome some of the insurance complexities that you're facing, but also help you also obtain coverage for those of our nonprofits that continue to struggle. And so I want to take this as a listening session as we also answer your questions, but know that we're taking the time to hear you out and want to be able to come back with you at a future date after we, you know, take our copious notes today and understand the issues that you're facing. And before we get to your questions, I want to again give you just an overview of the actions that I've taken to provide some financial relief to California consumers. Jan, you touched on it during my opening. You know, really, my priority was to get money back to consumers, our nonprofits, and our businesses, helping small businesses to file insurance claims, and obviously that includes our nonprofits, and combat fraud, expanding on the protection of health for every single Californian, and having access to health insurance is critical during a pandemic, and making sure that people that lost their jobs still were able to be covered. And as you said, I'm proud of the fact that now every child and young adult is covered for full scope Medi-Cal. And we had a recent victory a couple of days ago with Senator Maria Elena Durazo and the Latino caucus to ensure that every undocumented senior 50 years and over is now covered. That bill was signed a couple of days ago. And of course, the money's in the budget, again, demonstrating that California has to lead the way in taking and getting our immigrants out of the shadows and into care, because especially during this pandemic, we realized that they continue, our immigrant communities and our most vulnerable families are the ones that bear the brunt and still lack access to quality health insurance. And again, we continue to respond to the wildfires and how people prepare. As you said, last year, I'm proud to say that because of COVID, I was the only insurance commissioner that in this country that pushed to get these reimbursements for our California drivers and also for our businesses. I'm the only one that expanded the reimbursements to our businesses. And so I'm happy to say that, you know, it is now, my order has saved California drivers over $2 billion. And so if you haven't received a refund or some sort of credit, please call our office. We'll put our number on the chat. Or if you know of any of your clients or customers that have not received some sort of reimbursement on their driver's policy, let us know. When I ordered the insurance companies to return the money last April, I ordered them to give us data as well. And after reviewing the data, it was clear that the insurance companies did not do enough. My review of the insurance company data showed that while auto insurance companies made huge returns to consumers, they also continue to overcharge drivers. And so we're asking for another reimbursement. So if you haven't received your second reimbursement, let us know as well. And I'm ordering insurance companies to tell me how they're gonna make that right, not just for drivers, but for our businesses. So again, if the data that we're collecting continues to show that insurance companies overcharged our businesses and our nonprofits, I'm gonna mandate that they return those premiums, especially for so many of our small businesses and nonprofits that were closed, but we're still paying their insurance premium. And so again, if you have any questions about your home, auto, business, nonprofit insurance, please contact my department. And we have experts that will help you Monday through Friday. These are real people. They're not a recording. They speak multiple languages. So whatever language you're comfortable in, we're here to help you. And if you don't want to call us on our 1-800 number that should be on our chat, you can use our new live chat feature that's on our website at insurance.ca.gov. So again, I just want to close by reminding everyone that if you have any questions about any of your insurance, contact our department. You're going to hear me say this more than once, but it's important for you to know that we stand ready to help. We're on your side. My job as your insurance commissioner is to be the advocate for our consumers. And so again, thank you. I look forward to answering your questions about the issues that are affecting our California nonprofits. Thank you.
Thanks so much. And also thanks for bringing other people from your staff onto today. And I see that they've already put phone numbers down and websites down. So, I mean, that's really making you and your office accessible to people. So that's very much appreciated. And I especially like your point that, you know, that you may not have an immediate answer for everything, but I think you and your staff hearing what nonprofits are experiencing is really an important part of today's town hall. So we do have, I mentioned that we actually have 97 questions that were submitted in advance. So I wanted to ask a couple of them to start with. And so the first one, this was asked in a great many different ways, and I know we can't answer specific individual questions, but in general, what suggestions do you have for nonprofits to reduce their insurance costs? And in particular, we hear this from small nonprofits and from nonprofits in rural areas seem to be the people that are struggling the most with costs. What are your thoughts about that?
Yeah, we've been hearing that, especially for our rural nonprofits that might be in these kind of wildland urban interfaces or in areas where we've seen fires. It really depends on the type of insurance we're talking about, whether it's liability, property, or if you're, again, like I said, a wildfire risk, for example. Since the size of the specific type of nonprofit is critical to your individual risk portfolio and the ability to obtain affordable coverage, my recommendation would be that you speak with an insurance agent or broker that really specializes in nonprofits and discuss your profile and the type of coverages you may need. They should be available to advise you on how to reduce the risk and make your organization more attractive to insurers to get that coverage in the first place and to reduce your cost. If it's not satisfactory with the answers you're getting, then I would say give us a call and we can assist you. We can look at the type of policies that you need. It's important for you to tell and communicate to your broker or your agent about the changes that you might have made in order to make your nonprofit safer for your customers or your clients. This is we tell this a lot to the restaurants as well, because you've done so much to modify the way you provide your services. That is important for you to update your agent and your broker so that can also lead to a reduction in your cost. And I know it's like, so many of us sign the insurance policy and forget about it, and you want to do the good work, God's work that you all do to provide critical services. But I want you to be an advocate for yourself. And I also want you to know that, just like I always tell people in their individual insurance products, be it their home, health, or liability, or homeowners, is you want to keep yourself in competition for your business. You're entering into a business relationship with your insurance agent, or you're into this insurance policy contract. Yes, the insurance companies are going to make you feel like they're going to be like the good neighbor, or they're going to do this, but I want you to, when you're entering into that contract, I want you to ask, instead of, they're going to tell you what you're covered for, then I want you to turn around and say, what am I not covered for? Because then that gives you a clear indication if you might need more insurance, or if this is not a product that's going to work for you. And so again, every couple years, I want you to just talk to your agent and say, you know what, I'm going to go out and see what else is in the market. Keep yourself competitive.
So I really appreciate those comments, because I think too often we do think of our insurance brokers as somebody we just talk to once a year. And in fact, saying, this is the modifications we've made, or, what am I not covered for? Those are really great questions that encouraging people to ask those, particularly I think for small and rural nonprofits. Okay. So, I know this is kind of a big question, but overall, how has COVID-19 affected liability insurance? What's happened with insurability? Particularly around losses that might be related to COVID?
Yes, that's a question we get all the time. And even when you reopen, nonprofits are going to need time to recover. And I know liability due to COVID exposure is really a legitimate concern. We've been hearing it over and over again. And I also understand that the burdens being placed on our nonprofits as they attempt to re-engage with the public while still keeping their staffs and clients safe. It's not an understatement to say that lives are at stake, and now given with the Delta variant, that might just upend everything. So nonprofits, I think, really should follow the governor's resiliency roadmap as well as local guidelines for what processes they must follow, and that will go a long way towards reducing the impact of the virus and potentially liability. I also recommend that you, again, have that conversation with your broker and agent. Pick up the phone or shoot them an email and let them know, sometimes often the insurance company has their own guidance regarding how safely to return to business, and also to make sure that you have the right coverage in place. It's important for you to have that dialogue. If you need an expert from our department to help you decipher your contract, or to help you ask the right questions, or you're just not satisfied with the answers that you're getting from your agent or broker, again, give us a call. The information's on the chat box. We can help guide you and give you some sort of guidance in terms of, is this the right policy for you? Should you be asking maybe another question? Or for those of you that are impacted and are having a hard time finding insurance, we can go through your existing policy and look at if the insurance companies missed something, or if they, took an action that wasn't appropriate. Because as you know, California has the most stringent consumer protection laws, and often we catch them doing something that is not within the contract, and we end up keeping your coverage. So it doesn't hurt to have one of our insurance experts look at your contract.
Thanks. Again, I appreciate the emphasis on working with your broker. So, what you mentioned, the importance of looking at equality and inequality these days. California's fires are something that even before the pandemic were really worsening inequality in our state. And, how have the fires affected insurance availability and costs, particularly, of course, in wildland areas?
Right.
We have so many nonprofit camps. Right, nonprofit camps, nonprofit church camps, for example, or community camps, and conservation areas, all kinds of these organizations that are in, very much in the wildlands urban interface, but also a lot of nonprofits that are simply in more rural areas. How are the wildfires affecting them?
Right. No, thank you. And, again, another question, depending on where you live, insurance is getting harder to find and more expensive to keep for everyone, our nonprofits, our homeowners, our businesses. And first, during active wildfires, we are seeing, like the ones we're seeing in Northern California, insurance companies may stop writing new business in those areas until the fires are under control. And so, but even when there is no active fires, the past few years of wildfires have resulted in insurance companies really restricting their writings and increasing premiums in the wildland urban area or wildfire prone areas. For example, just 2 out of 17 of the 2018 wildfire insurance companies, they paid out more than $25 billion in claims. Yeah. And more insurance companies are using wildfire risk scores to decide if they're even going to insure you. In the past, insurance companies really would evaluate each property based on, entirely your own characteristics and conditions. Today, homes must pass through this filter called a risk score based on satellite imagery of your region. And if you don't even get past that, if you don't get a passing score, you don't get coverage. And so right now, insurance companies are not required to give you your score or even allow you to appeal your score if you believe it's based on wrong information, because all that information is in a black box. And so yet they're making decisions on what homes, what businesses, what nonprofits to write and base their number on. And I don't think it's fair. And so I want to see greater transparency for these wildfire risk scores, these models, and the ability and give the consumer the ability to appeal their score and take steps to legitimately take care of that, to mitigate their score. And so that's why I'm proud to say I'm proposing new regulations that my department's working on that will require insurance companies to provide consumers with their property's file risk score, and then allow you to appeal your score, give the property owner, the business owner, the time to correct any issues to lower their score, and make sure that the scores recognize the mitigation that you all have done, such as creating that defensible space and home hardening. And so, I'm proud to say we're working on those regulations, and we're going to be promulgating those to the public very, very soon.
So, Commissioner, what can we nonprofits do to help you get those regulations passed and pressure the companies around this?
So I would say I'll have my staff put the information on when we're having our regulatory hearings so that we can have you engage in that process and say you're supporting these regulations, because of course, as you can imagine, the insurance companies want none of this. They want to just arbitrarily offer these, assign these scores and determine where and who they're writing. And so short of me having the authority, which I wish, to mandate that they write insurance in these communities, which I don't have, the least I could do is say, you need to give us and be transparent with these risk scores and give people the opportunity to mitigate and bring their risk score down so that they could keep their insurance policy.
Right, thanks. So, 2/3 of California nonprofits are all volunteer. What thoughts do you have for what insurance is needed and how to get it for these all volunteer organizations, some of which are not small, and all volunteer don't necessarily go together. We have very large all volunteer organizations in California as well.
Yeah, I would say again, it's really, it depends on the type of insurance we're talking about and the type of nonprofit you are. Since the size and specific type of nonprofit is really critical to your own risk, right? Because it's always about the type of risk that you're incurring to do your job, and the ability to obtain affordable coverage is essential. So my recommendation is that, again, speak with your agent, or if you want to speak with us first, and we can gauge you in terms of what type of nonprofit you are, your size, so that we can help you with some of the questions that you might need to ask your agent. That, your agent should be able to advise you on how to reduce your risk and make your organization more attractive to insurers to get coverage in the first place, or at least to help you reduce the cost. Again, we can help you do that. And why, one of the first things I did when I became insurance commissioner is actually get the department out of Sacramento, out of LA, and we've gone to over 36 counties and visited with community leaders. And we're more than happy to, once we are able to get back out there, meet with some of the nonprofits to see and engage with you on what are some of the issues that are happening in your community, and that would allow you to continue doing the great things that you're doing.
That would be great if we have a chance to engage in those regional events. Thank you for that. And, we want to be helpful in your efforts to spearhead some of these reforms. Thank you. So we also have a chance today to hear from a couple of community folks. And the first one is Julia Clothier, who has got a beautiful background there. Just to introduce her briefly, she's the COO of Audubon Canyon Ranch, which is a science center, a conservation area, and an educational center. And in fact, I remember going on field trips with each of my two kids to go to Audubon Canyon Ranch. And so if you ever have a chance to do that, I hope you'll take advantage of it. And Julia, can you let us know something about your experiences with insurance in your area?
Sure. Thanks, Jan, and thanks, Commissioner. It's a pleasure to be here. I'm going to just tell about one specific program area because I think it's illustrative of what's going on in terms of nonprofit insurance statewide. In 2018, my organization launched a program called Fire Forward. It's a community-based initiative. It applies prescribed fire and other vegetation management techniques to hundreds of acres in Sonoma and Marin counties. Our land, we own 5,000 acres, but many more acres than that. And the work reduces wildfire risk in the wildland-urban interface for thousands of property owners. The activities are carried out by certified professionals under the highest possible standards, monitored by CAL FIRE. It's very rigorous. And every prescribed fire requires a state certified burn boss on the ground, and federal and state employees who are certified burn bosses are indemnified by the government, but private burn bosses aren't. Right now, there's a Senate Bill 332 that would provide some protection for private burn bosses and the NGOs that they work for. We hope it passes. But what I want to share is, in the last 4 years, the cost of our property and liability insurance has more than tripled. And this year, our carrier declined to renew, and we've been turned down by at least 13 markets, in a large part due to the Fire Forward program. So it's confusing and frustrating that carriers are denying coverage to a project that's actively engaged in reducing wildfire risk, right? So there's a gap between perceived risk and actual risk. And what's happening is, excuse me, we're disincentivizing organizations from undertaking this really important work. Like, we all know that this needs to happen. So what can we do to educate insurance carriers so that we can keep them engaged and providing this coverage so that this essential work can continue to happen?
Thank you, Julia, for your question. And first of all, I support the work that you're doing 100%. It is critical. And we're engaging in conversations with the insurance industry on how do we come up with some sort of liability insurance product that's actually affordable, not only for nonprofits like yours, but for conservancies, for so many of these organizations that are doing this critical work. We know that prescribed burns are better for the environment. We know that they, when done successfully, completely mitigate in terms of against fires. The conversations around prescribed burns with the insurance industry is just like, you know, the risk of this fire going out of control, right? And we understand that, but we're trying to figure out what type of product, what protections the insurance company would need, and how can we craft together a policy, one that's available, that's affordable, so that we can continue to do these types of prescribed burns. Because at the end of the day, if the insurers don't want to cover this and we disincentivize these prescribed burns, then we get a wildfire. Then that's not good for anybody. And so I know Tony Signorelli is in from my office. I know he's been the one leading a lot of these conversations. Tony, do you want to jump in, or if I missed any of the answers?
Oh, Commissioner, you said it. I would just add here that part of your task force with your partnership with your governor's office and Cal Fire is to look at different mitigation, areas of mitigation, both in construction, but also, you know, topography of the land in terms of mitigation. And that does include a proper program for prescribed burns. And I think once that gets in place, insurers will be more comfortable because it'll be more commonplace, rather than for the last 20 years, it was very uncommon for prescribed burns to happen. And it kind of restricted the market for both the prescribed burn bosses, et cetera, but also for the people that own the land that were doing that. And so the hope is that through those mitigation standards that are in place and other mitigation techniques, such as the prescribed burns, to become more commonplace, that the insurers will get a better, you know, level of comfort to be able to insure these properties and insure also for those prescribed burns.
And just to make sure, Tony, if you can inform Jan and Julia when we're having those conversations, when they go public, in terms of you know, support for these type of products that support the prescribed burns is going to be important because they are doing the important work.
I also just want to say, you know, we have a nonprofit community has a lot of environmental and forest scientists among us, including those that work at Audubon Canyon Ranch. And I hope that even outside the public events that you'll take advantage of the expertise and the kind of the hands-on stuff that we're doing and have learned about and are pioneering as you develop these regulations.
Absolutely. We would love to get the more folks engaged, the better, especially if you have some climate scientists, fire scientists that we've been working on as well.
So Julia, can you also put your information, your contact information so that the commissioner and Tony can maybe reach out to you at a later point? Okay, I want to thank you so much. And I can hardly wait to go to visit Audubon Canyon Ranch again. All right, so next I want to introduce Stephen Waters. He's the Executive Director of First Step Communities, which he's kind of sitting in front of a picture of right now. And they're an organization that provides a variety of services to people who are homeless. And one of the things that they've also done, and it's very interesting, is they're working on right now is they've just helped open the first city approved camping and parking site for homeless people in the Sacramento area. So Stephen, tell us your experiences with insurance recently.
Well, thank you very much. And thanks for the little summary. We were formed as a nonprofit 6 years ago with the concept of working very hard with our city, our county, and indirectly our state to try to fill the gap between the need, the level of need, the number of homeless individuals, and the amount of affordable housing. There's just a huge gap, as we know. We've got a housing crisis that just contributes to that. As a result, we've spent the last 6 years proposing different types of solutions and also running for the city, the county, and the housing authority, a number of different projects ranging from traditional shelters to cabin communities. And now, as Jen said, most recently opening the first legal encampment in Sacramento. What that legal encampment includes is illegal camping areas where we can put people in what we call here safe grounds, where we can give them safety from the streets. We actually can control the access, where we can give them meals, and where we can bring in services to them, even out in the field like that, to help them move towards more permanent solutions. The second thing it includes is safe parking areas. So we found in Sacramento a large number of people living in vehicles ranging from regular sedans, automobiles, to RVs. And we have some sites where we have safe parking for those, again, with controlled access and the same kind of thing. We bring in meals and services. The problem we've run into is it's very, very, very hard to insure these legalized encampments. What I've learned working with the folks at Cal Nonprofit Insurance Services, who have put in great efforts to try to find coverage for this, is that there's a real concern within the industry of insuring these types of encampments, and even to a lesser extent, but also to some extent, the safe parking. If I understand everything correctly, I think that the biggest concerns in the insurance industry have to do with fear of claims of abuse and fear of claims of personal injury and other things related to fire. And from my perspective, again, very biased as operator of this organization, it's very frustrating because we take a lot of actions and put a lot of things in place to mitigate these things before they happen. In all the programs we've run these last 6 years, there's never been an abuse claim, and we have not had a fire. I realize these things are common, perhaps, nationwide in these types of environments, but we haven't had any. In other words, we're taking the appropriate action. But because the type of program we're running was lumped into a class, we are just denied in most cases, even the quote. So that is something it not only holds us back as a small nonprofit doing this in Sacramento, but it puts restrictions on local governments, municipalities, what they can do to combat what I see as an epidemic of homelessness, especially in California. We unfortunately probably have the highest numbers of any state.
So one of the ideas that we've been looking at, Stephen, is how do, in these circumstances, one, I'm actually doing for the first time ever a data call, which means I'm asking insurers to give me data on their underwriting, the products they offer when it comes to camps in general, or any outdoor, because we're seeing that even our youth group camps are being denied coverage. And so we're collecting that data. We'll have that by the end of the summer, so that my staff, my actuaries and staff can look at it and see where the lack of coverage is and how we lessen that protection gap. Meaning, how many of these folks are self-insuring, how many of them are underinsured, so that we can try to come up with ideas of how to address this issue. And first of all, thank you for the work you're doing with our unhoused community. One of the ideas we've been kind of talking about is how do we create some sort of public-private partnership where the state or the local government enter into an insurance product or policy with the backing of the city, so that it makes it much more attractive for the insurer to engage and create some sort of policy. But again, these are still all things that we have in the drawing room, I should say, and that we're trying. This is why today is important, because this is yet another example that we can take back to our actuaries and have a conversation about how do we create essentially a new product to meet this unfortunate situation that we're in as a state. But you're not the only camp that's having these issues. We're seeing all kinds of camps, from sober living camps to just summer camps in general. So Tony, any other thoughts or anything that I might have missed?
Commissioner, the only thing I would add is that what you've also asked us to look into is the California Fair Plan, and looking at its ability to service as many people as possible that need it. And that includes looking at the policy limit, because I know it's at $3 million.
Right.
And so that's another piece of the puzzle that the commissioner and the department will be looking at over the next few months, to see if those that might be eligible for the FAIR Plan but don't think it's enough coverage, we'll be looking at that issue also. I'd also suggest that I'm not sure what your specific need is, but if you haven't looked at the FAIR Plan, it might be worth looking at for your at least first layer of coverage, and then maybe seek after the 3 million,
Right.
see if you can get an excess policy on top of that. And some insurance companies may be more comfortable writing the excess coverage rather than writing the primary first layer of coverage. So every nonprofit's different, but again, if a nonprofit wants to contact us, we can kind of go through some of these options that might be available.
So Stephen, give us a call and let's work through some of the issues that you have, and maybe together we can come up with something innovative that we can try to pilot statewide.
Thank you. I appreciate that. I'm afraid that the issue we're talking about that my organization works with is going to be with us for a little while. It's not something we can solve quickly, and so this is a necessary step.
Thank you.
All right. Thanks so much, Stephen, and thanks for those responses, Tony and Commissioner Lara. So we only have about 150 more questions to go through. So just to a couple of them from the Q&A box. So one is, as an advocacy organization, we at Cal Nonprofits pay a lot of attention to regulations and to and to legislation in particular. And one of the rumors we've been hearing recently, says one of these questions, is that affinity groups for auto insurance might be eliminated, and that would also hurt. And I guess we're hearing different opinions, that it might hurt poor people and people of color, and other people saying that the current affinity group systems mostly hurt wealthy people. So what's going on with this whole affinity group thing?
Yeah. No, well, thank you. And thank you for that question, because it does get a little complicated. For years now, various consumer groups have been asking the insurance commissioner to look at these affinity groups. And if you think of the insurance market as a balloon, you realize that it's a finite amount of premiums that you get, right? And so when you give somebody a discount, then you take away from somebody else because it's a finite amount, right? And so finally I said, you know what, let me do the research and let me figure out what's happening in California with these affinity groups. And affinity groups can range from, a union membership to your Costco membership to an insurance company just saying, we're going to create an affinity group of just architects, and we're going to give them a discount. Ironically enough, the data shows that the people that are being offered these affinity group discounts tend to live in wider zip codes, in more wealthier communities, and in professional settings. They're not offering these discounts to janitors, to seamstresses. And so the argument is it's these type of workers that are offsetting the cost for the insurance companies offering these affinity group discounts to, say, more affluent communities, because what they want to do is eventually they want to upsell you. They want to repackage your home, life, auto, and then they see folks like that as more of a deal. So they want to entice you. And then what we also realized is that a lot of these insurance companies were just creating groups on their own. And so where we're trying to find a balance is we want affinity groups. We want our teachers union to keep their affinity group discount, because guess what? It's tough to be a teacher and you're not making a lot of money, and we want you to get that discount. Or if you are part of Costco, for example, we want you to keep that because there is no discrimination there. Everybody gets a discount, right? When you become a Costco member. And so for us is really, and what we're trying to thread the needle is eliminate the ability for insurance companies to just create out of the blue affinity groups from non-legitimate organizations, right? So it doesn't remove any affinity group from an established organization on its own, and you keep that discount, and we want you to keep getting it. But what we don't want is insurance companies, from what we're seeing in some of the current practices, is they just pick a group and say we're gonna give them a discount, and we're gonna file with the department and say we're gonna give all architects in California randomly without any affinity to like the Architect Association or Society of California. They would be qualified because they're an actual group that was established independent of the insurance company. And so that is what that's what we are working to do. And I wanted to really study this issue. And of course, like any big issue, it gets complicated, but we have really detailed maps around the big cities in California where you could really see, for example, in LA, the west side of the city gets much more access to affinity groups than people from where I grew up in East LA and Boyle Heights. And so we're trying to find that balance, right? Because if you're an established group, you can have your discount. But we want insurance companies to stop creating their own groups on their own. So that's essentially what we're trying to do, Jan.
Thanks so much. I think one of the things that we've learned in preparing for today's session is just how much of insurance costs are influenced by law and regulations, and what an important role the California Department of Insurance plays. We have a number of questions related to insurance for volunteers. And I know some people have been able to get workers' comp for volunteers, but volunteers, and sometimes volunteers are on site working with vulnerable populations. Sometimes volunteers are in their own homes taking care of rescued animals. What can we do to work with your office to develop sort of more insurance liability, more insurance options, workers' comp-like options for volunteers?
Thank you. That's a great opportunity for us to really work together. I know in terms of we were doing our own kind of research on some of the issues that you brought up. And this is really an area where we think there's not enough dialogue happening around how do we create liability insurance for volunteers? What is a volunteer? How do you define a volunteer? How many hours does a person have to volunteer to then be liable for the organization or the nonprofit? All this kind of questions started coming up. And so I look forward to getting together with you all and really honing in on this specific issue so that our nonprofits can have a clear, and the insurance industry have a clear pathway in terms of how do we treat volunteers? How do we assess the risk of volunteers? Because we know that, I mean, our nonprofits cannot survive without volunteers. And so it's critical that, you know, this, and I committed my staff to working with you and your organization on how can we really come up with something innovative in this space.
Thank you. You know, not only are nonprofits really important volunteers are important to nonprofits, but also nonprofits are really important to communities. And in fact, in California, nonprofits mobilize the equivalent volunteer hours of 411,000 full-time staff. So that's an army of people that we are trying to protect here. You know, in the world of taxes, you know, because so many people have, particularly people who speak another language, may have difficulty filling out their tax forms. And so there are a lot of services that help people fill out their tax forms for free, right? If they have trouble doing that. And, you know, are there some kinds of similar kind of parallel programs that help people, you know, wrestle with insurance questions?
Absolutely. You know, this is why, Jan, look, and we do have a very extensive fraud operation that many people don't know. I have over 300 agents and investigators that go after people who commit insurance fraud. And you can imagine, Jan, who are the targets in California? Our monolingual speaking immigrant communities, our immigrant business owners that get sold a fake workers' comp policy. And it's even increasing now during the pandemic, right? And so, first of all, if you feel you've been a victim or you know somebody that has been a victim of any type of insurance fraud, life, workers' comp, call us at that same number. And we use that information as a tip to go send our investigators. And we've been able to recover millions of dollars just based on our tip hotline, which is the number in the chat room. Please give us a call. Again, this is another reason why, I told my staff, we need to get out of Sacramento and get out of LA and go out and talk to communities. It's like old school organizing and having people know who the Department of Insurance is. We have so many resources for them. If you have any questions on a policy, if you're a business owner, if you don't understand your policy, we have these insurance experts that can help you. We do this now after the wildfires. We go into the local assistance centers and talk to people in their language to help them rebuild, help them answer the questions they need. And then on our website, we also have tons of tools in various languages that help people understand their product. And look, I always say insurance is complicated, and it's something that we tend to, at our own peril, I should say, tend to just ignore. And the insurance companies want you to ignore them and just pay your premium and don't ask questions until you have a claim, right? And so, any ideas that you have for us to partner with you, either throughout the state to offer these services, I've doubled, if not tripled, my outreach team to do just that, to go out to communities and have these conversations about how we can help protect you when you're entering into an insurance policy, how to understand your insurance policy, and then how to make sure that if you're monolingual, that we get you the tips, the tools in your language that you can help you better understand the business contract that you're entering into.
So Commissioner, this 800 number that's in the chat, is that something that people can give to their constituents, their clients, and their— Absolutely. And is that a multilingual line as well?
Yes, we will connect you with a live person who speaks your language.
Great. Well, it's time for us to wrap up. I want to thank all of our speakers. Just before I ask you to give us some final comments, Commissioner, I just want to thank particularly kind of everybody on our team here. So on our tech side, you know, I think you guys all have seen, you know, we have Henry Duong, who opened it up for us today, as well as Karina Pereira-Sozola, also from our staff. Lucy Salcedo Carter is our policy director, and she's been very helpful in working through all the questions and framing this today. And then we have several people from the Department of Insurance to thank, in addition to the Commissioner, Deputy Commissioner Tony Signorelli and Tanya Martin and Destiny Flores, who made it so easy for us to work with them, getting sure all the little ducks were put in place here. And then lastly, I just wanted to thank our closed captioner, Kayla Peters. I think that's a very important part of our commitment to making sure that this is as helpful as it can be. And just to remind people that this has been recorded, and people will be sent a recording, as well as a lot of the resources that have been put in the chat box. We'll put those into that follow-up email, so you don't have to have written them down if you didn't so already. So Commissioner, can you give us any, I don't know, some sort of like the kind of, what kind of words about insurance should be engraved on public buildings, or what are your last thoughts here?
Well, first, Jen, look, I just want to thank you again for inviting me to participate this afternoon and discuss with you and share the information on the resources for our nonprofits across California.
Right, and being willing to listen to what our concerns and worries are.
Absolutely. You know, I want to just really, again, close by reminding everyone that if you have any questions about insurance, or your clients have questions, you know, we often don't think about, you know, the department as a resource. I'm trying to change that. And that number is there to help you. And again, whether it's health, life, business, know that my job is to be your advocate. And so we have a team of dedicated staff that do just that every day. Every year, we bring in millions of dollars that we collect back to consumers who either, you know, the insurance companies did something wrong to them or we went after them. That's exactly what we do. And so, and if, again, I want to make our staff available, our outreach team, who you already know, Jen, for any of our nonprofits that want us to have something similar like this, just with your nonprofits and your clients. This is what we do. And this is why I increased the amount of staff that are available and open to have these dialogues with your clients, with your customers, with your constituents. So again, we're here to help. We're here to be on your side. And again, I look forward to doing this again real soon. So thank you.
Thank you. And just a reminder to everybody that our ability to do this for free is in large part due to our memberships. So I want to thank all of our members. And if you are not yet a member, please think about becoming a Cal Nonprofits member. All right. Thanks, everybody. Goodbye.
Bye.